All right, so let's dive into something that I think affects a lot of us. Dry eye disease.
Yeah.
You ever feel like you got sand in your eyes?
Mm-hmm.
Yeah. It's not fun.
Not fun at all.
So we got a whole stack of medical research articles and studies here all about dry eye.
Oh, wow.
By the end of this deep dive, you'll be able to impress your eye doctor with just how much you know.
All right.
We're going to cover what it is, what causes it, how you can spot it, and then what you can do about it.
Sounds good.
And get this. Studies show that dry eye can affect anywhere from like a tiny percentage of people
Okay.
to like a whopping 50% of middle-aged and older people.
Wow. That's a huge range.
That is a huge range.
It is, and that's part of what makes dry eye so tricky. It's not always obvious. So let's start with a solid definition. A 2019 study by Hallan and their team defines it as, and I'm quoting here, a multifactorial disease of the ocular surface characterized by a loss of homeostasis of the tear film and accompanied by ocular symptoms in which tear film instability and hyperosmolarity, ocular surface inflammation and damage, and neurosensory abnormalities play etiological roles.
Okay. That's a mouthful.
Yeah.
So what's homeostasis in this context? It sounds kind of sci-fi.
You can think of it as balance.
Okay.
Homeostasis is all about keeping things stable. So in this case, we're talking about the tear film.
Okay.
That thin layer of moisture that coats your eye. Dry eye disrupts that balance, messes with the tear film, and it causes kind of a cascade of problems.
Oh, wow.
It's not just dryness. It's a whole system out of whack.
Yeah.
Leading to inflammation, damage, and even issues with the nerves in your eyes.
So it's way more than just like feeling a bit dry.
It is.
And speaking of what causes it, this study by Alana points to a ton of factors, like age, medical history, even things like chronic conjunctivitis, those pesky refractive errors like nearsightedness, and even a condition called Sjogren's syndrome. What is that all about?
Sjogren's syndrome is an autoimmune disorder where your immune system attacks glands that produce moisture,
Oh, wow.
including the ones that make tears. That's why it can lead to really severe dry eye.
Okay.
And you're right, there are a bunch of potential culprits.
Yeah. And it's not just what's going on inside your body, right?
Right.
This paper even hinted that like humidity levels could play a role.
Yeah.
So listeners, think about where you live. Is it dry? Humid? Maybe that's affecting your eyes more than you realize.
It could be.
What about those refractive errors? How can needing glasses or contacts mess with your tear film?
Well, if you have a refractive error, it can affect how often you blink.
Okay.
And blinking is super important for spreading that tear film evenly across your eye.
Oh, I see.
Plus, if you're straining to see, your eyes might dry out faster. It's all connected.
So let's say you're starting to suspect you might have dry eye. What should you be on the lookout for?
Okay.
What are the telltale signs?
So this research from Harrell and their team in 2023 lays out the classic symptoms. Dryness, grittiness, that feeling like you've got sand in your eye,
Right.
burning, scratchiness, even watering.
Okay.
That's your eye trying to overcompensate for the dryness.
Oh, so it's like your eyes are playing a cruel joke on you, like, oh, you're dry. Here's some extra tears that don't actually help.
Right. Exactly.
But wait, this study also mentions like less obvious symptoms like eye fatigue,
Yeah.
pain, and even blurry vision.
Right. Decreased visual acuity, they call it.
Okay.
Dry eye can seriously mess with your vision, making it blurry or fluctuating, and that can be super frustrating and even dangerous if you're driving or doing anything that requires sharp vision.
Okay, that's making me a little nervous.
Yeah,
So it's not just about comfort.
it's not.
It's about being able to see properly. But how do doctors actually figure out if it's dry eye? Is it just like based on how your eyes feel?
Nope, they've got tests for that.
Okay.
One is the Schirmer test, which measures how much tear fluid your eyes produce. Marascas and their team talked about that in their 2024 study. There's also the tear breakup time, or TBUT, which measures how long it takes for your tear film to break up after you blink. We see that discussed in a 2023 paper by Gupta and colleagues. These tests help determine how severe the dry eye is and guide treatment.
So it's getting pretty serious.
It can be.
Let's move on to the part everyone's probably been waiting for.
Okay.
What can we do about it?
Yeah.
What are the treatment options?
Well, the good news is we've got options. From simple things like artificial tears,
Okay.
those are usually first line of defense, to more advanced procedures.
Oh, before we get to the advanced stuff,
Yeah.
let's talk about those artificial tears.
Okay.
Do they actually work? They seem almost too simple to be effective.
They can be surprisingly effective for mild to moderate dry eye. A 2019 study by Ribeiro and their team found that artificial tears can help stabilize the tear film and reduce inflammation. They're like a little dose of soothing moisture for your eyes.
Okay, that makes sense. But what about those more advanced options you mentioned? What if artificial tears aren't cutting it?
One procedure is called punctal occlusion.
Punctal occlusion.
It sounds scary, but it's basically a tiny plug that's inserted into the tear duct
Oh, wow.
to keep those precious tears from draining away too quickly. A 2023 study by Cato and their team describes it as a pretty straightforward procedure.
Wow. Blocking your tear ducts, that's some next level stuff.
Yeah.
What if even that's not enough?
Right.
Is there anything else on the horizon?
There are some really cool things being researched.
Oh.
One promising area is using something called curcumin-loaded liposomes.
Okay.
You know, curcumin, that stuff in turmeric.
Yeah.
Well, Baranowska's and their team found that these liposomes show real potential for treating dry eye and a condition called meibomian gland dysfunction.
Wait, hold up. Meibomian gland dysfunction. What in the world is that?
It's when the glands that produce the oily part of your tear film aren't working properly.
Okay.
And that oily layer is super important because it prevents the tears from evaporating too quickly.
So it's like the oil slick on top of a puddle, keeping the water from drying up.
Exactly. That's a great analogy.
But tell me more about these liposomes. How do they work?
They're basically tiny bubbles that deliver curcumin directly to the eyes, where it can work its magic in reducing inflammation and improving tear production.
That's incredible. So curcumin, it's not just for lattes anymore. Are there any other cutting-edge treatments in the works?
There is. Researchers are exploring the use of mesenchymal stem cells, or MSCs for short.
MSCs.
These cells have the potential to tackle both tear hyperosmolarity,
Okay.
that's when your tears are too concentrated, and inflammation, which are two major players in dry eye. A 2024 study by Harrell and their team highlights how promising this treatment could be.
MSCs, curcumin. It sounds like the future of dry eye treatment is going to be pretty high-tech. And it's happening all over the world.
Yeah.
We even found some fascinating work being done by Professor Dr. Suhail Sarwar, an eye surgeon in Lahore, Pakistan.
Yes. Professor Dr. Sarwar is a leading expert in dry eye treatment, especially when it comes to meibomian gland dysfunction. He's been pioneering new techniques to diagnose and treat this condition, helping tons of patients find relief from their dry eye symptoms.
That's so amazing to hear. It's inspiring to see experts like him pushing the boundaries of what's possible in eye care.
Absolutely.
So listeners, if you're dealing with dry eye, don't despair. There's hope and there are solutions out there. But this is just the tip of the iceberg. We've got way more to unpack in this deep dive, so stay tuned.
Absolutely. We're just getting started. You know, while we've been focusing on like the physical side of dry eye,
Right.
we can't forget about like the mental and emotional toll it can take.
Yeah.
A 2020 study by Toth and their team found a strong connection between dry eye symptoms and anxiety. Yeah. People who are more sensitive to anxiety tended to have worse dry eye symptoms.
That makes total sense.
Right.
When your eyes are constantly uncomfortable, it's bound to mess with your mood and your stress levels.
Yeah.
It's like a vicious cycle.
It is.
The anxiety might even worsen the dry eye.
Exactly. It highlights how important it is to take a holistic approach to treatment.
Yeah.
Addressing both the physical symptoms and the emotional impact.
For sure.
But it's not just adults dealing with this. We found a 2021 study by Minashita and their colleagues that looked at the link between screen time and dry eye in kids.
Oh, wow.
And guess what? They found a connection.
Really?
The more time kids spent staring at screens, the more likely they were to have dry eye symptoms.
Screen time and dry eyes in kids. No surprise there.
Right.
All that focusing and not blinking enough?
Yeah.
It's a recipe for dry, irritated eyes.
All right. When we're glued to screens, we tend to blink less, which means that tear film evaporates faster. Plus, the blue light from screens can contribute to eye strain and dryness.
So parents, take note.
Yeah.
Limit that screen time. Make sure your kids are taking breaks to rest their eyes.
Definitely.
But speaking of screens, we were talking earlier about refractive errors.
Yes.
And how they can contribute to dry eye. So people who need glasses or contacts are more prone to it.
It's definitely a possibility.
Okay.
As we discussed, refractive errors can affect blinking patterns and lead to eye strain,
Right.
both of which can worsen dry eye.
So is the solution to just get LASIK or something?
But doesn't eye surgery sometimes make dry eye worse?
It can be a risk,
Okay.
but thankfully advancements in surgical techniques have really reduced that risk.
Okay.
A 2019 study by Wong and their team actually found that a type of laser eye surgery called SMILE
Smile.
resulted in a faster recovery from dry eye symptoms compared to LASIK.
Smile surgery. I've never even heard of that.
It's a newer, minimally invasive procedure that uses a femtosecond laser to create a small lenticule, or lens-shaped piece of corneal tissue that's then removed through a tiny incision. Oh, wow.
It's considered to be a very precise and gentle procedure with a faster healing time and potentially fewer side effects than traditional LASIK.
Wow, that's fascinating. Laser eye surgery has come a long way.
It has.
But let's get back to treatments for dry eye.
Okay.
We talked about artificial tears, punctal plugs, and even high-tech solutions like stem cells and curcumin liposomes.
Right.
Are there any more natural approaches being researched?
There are. A 2020 study by Thacker and their team looked at using a natural plant extract called Blatilla striata polysaccharide as a potential treatment for dry eye.
Blatilla striata polysaccharide.
Yeah. Say that 3 times fast.
I know, right?
What is that and how does it work?
Yeah.
It's a type of orchid that's been used in traditional Chinese medicine for centuries.
Oh, wow.
The researchers found that this polysaccharide, when added to artificial tears,
Okay.
showed promise in helping the cornea heal and improving tear production in rabbits with dry eye.
So plant-based remedies could be part of the solution.
It could be.
That's really cool.
Yeah.
It's amazing to see how research is pulling inspiration from both nature and cutting-edge technology.
It really speaks to the complexity of this condition.
Yeah.
There's no single magic bullet,
Right.
but rather a combination of approaches that can help manage dry eye effectively.
Yeah.
And it all starts with understanding the causes and symptoms, which is what we've been focusing on in this deep dive.
And I think we've done a pretty good job of that.
I think so too.
We've covered so much ground, from the basic definition of dry eye to the crazy variety of causes, symptoms, and treatment options.
Yeah.
It's been quite a journey.
It has. And we've even had the chance to highlight the incredible work being done by experts like Professor Dr. Suhail Sarwar in Pakistan.
Right.
His research on meibomian gland dysfunction is truly groundbreaking.
Yeah, listeners, if you're interested in learning more about Professor Dr. Sarwar and his work, just search his name online.
Yeah.
You'll find tons of information about his innovative approaches to dry eye treatment. But, one thing that struck me as we were going through these studies was how much emphasis there is on the physical aspects of dry eye.
Right.
The tear film, the glands, the cornea.
Mm-hmm.
But what about the person behind the eyes? How do people cope with dry eye in their daily lives? It must have a huge impact.
You're so right. It's easy to get caught up in the science, but we can't forget about the human experience.
Right.
And speaking of that, we found a 2018 study by Yeo and Tong that explores just that, how people cope with dry eye.
Okay.
They used a really interesting approach. They conducted focus groups with people who have dry eye to understand their experiences and what they do to manage their symptoms.
Okay.
They found that people use a whole range of strategies, from simple things like warm compresses and eyelid hygiene to more complex lifestyle changes and even alternative therapies like acupuncture.
So it's not just about eye drops and procedures.
It's not.
It's about finding what works for you and taking control of your eye health.
Exactly. And it highlights the importance of open communication between patients and their eye doctors.
Yeah.
Understanding the patient's perspective, their concerns, and their coping mechanisms can help tailor treatment plans more effectively.
Right.
It's about working together to find the best solutions.
I love that. It's a team effort.
Yeah.
And listeners, remember, you're not alone in this.
Right?
Millions of people are dealing with dry eye, and there are resources and support systems available to help you navigate this condition.
Absolutely. And we always encourage our listeners to be proactive in their health journey.
Yeah.
Don't hesitate to ask questions, seek second opinions if needed, and advocate for your own well-being.
Mm-hmm.
Knowledge is power.
Yes.
And the more you understand about your health, the better equipped you'll be to make informed decisions.
I couldn't agree more. So listeners, if you're experiencing any persistent eye discomfort, don't just brush it off.
Right.
Talk to your eye doctor, get a proper diagnosis, and discuss your treatment options.
That's such an important point, and it's crucial to remember that dry eye is often a chronic condition, which means it requires ongoing management.
Okay.
It's not a one-and-done situation.
Right.
It's about finding ways to keep your symptoms under control and maintain the health of your eyes over the long term.
It's like a marathon, not a sprint.
No, exactly.
This has been an incredible deep dive so far.
Yeah.
We've learned so much about dry eye. It's truly a multifaceted condition.
And we're not done yet. We've got one more part to this deep dive where we'll explore some even more mind-blowing aspects of dry eye.
Can't wait.
So stay tuned.
Okay, so we've talked about the causes, symptoms, and treatments for dry eye, and even touched on the emotional side of things.
Right.
But are there any serious risks if you just kind of ignore it and hope it goes away?
Well, in most cases, dry eye is more annoying than dangerous. But if you leave it untreated for too long, it can lead to some real problems.
Like what?
Like damage to your cornea, that's the clear front part of your eye. And a damaged cornea can make you more susceptible to infections and even vision loss in extreme cases.
Whoa! I had no idea it could get that serious, so it's definitely not something to mess around with.
Exactly. And here's another thing to keep in mind. Dry eye can sometimes be a sign of something else going on in your body,
Oh, really?
like an autoimmune disorder or even a vitamin deficiency.
Huh.
We found this case study from 2019 by Warda and their team, where a young boy's dry eye turned out to be caused by a lack of vitamin A.
That's wild. So dry eye could be like a little red flag telling you to pay attention to your overall health.
Precisely. That's why it's so important to get a thorough eye exam if you're having any kind of persistent eye trouble. It could be more than just dry eye. It could be a clue to something bigger.
This has been such an eye-opening deep dive, pun intended. It feels like there's so much more to dry eye than meets the eye.
I think that sums it up perfectly. Dry eye is a complex condition that deserves our attention, and hopefully after listening to this, you're feeling a lot more informed and empowered to take care of your eye health.
Absolutely. We've armed you with a ton of knowledge, but the real magic happens when you put that knowledge into action.
Right. Be proactive. Talk to your eye doctor, and don't be afraid to advocate for your own well-being. Your eyes will thank you for it.
And to wrap things up, we want to leave you with a little food for thought. We've talked a lot about the surface of the eye, but what about the brain? Could our mental and emotional state actually influence how we experience dry eye symptoms?
That's a really interesting question.
It's a fascinating question that researchers are just beginning to explore.
Yeah. Think about it. Stress, anxiety, even your mood can impact so many other aspects of your health.
Right.
Why not dry eye? It's a whole new frontier for research.
Mind-blowing. But there you have it, folks. A deep dive into dry eye disease that's left us feeling informed, inspired, and maybe a little teary-eyed, but in a good way, of course.
Until next time, keep those eyes healthy and happy, and keep exploring the fascinating world around you.
And remember, knowledge is the best medicine. Thanks for joining us for this deep dive, and we'll catch you next time.